If you've been told that PCOS or polycystic ovarian syndrome is just a weight problem or fertility problem, I'm here to tell you that that's outdated medicine. Did you know women wait up to 2 years and visit over 3 healthcare professionals before they usually get to a definitive PCOS diagnosis? It's time to separate the myths from the science, because if you've been living in a body that feels like it's confused about what works well for you, you've just never been given the full picture. PCOS is the most common hormonal disorder in women of reproductive age. It affects up to 1 in 6 women globally, and that number jumps up to 1 in 4 women in the MENA region. I'm sure you've heard of someone who has it. I'm sure you know someone who's been affected. But despite it being so common, it's often misunderstood, misdiagnosed, or overlooked entirely. Today, we're going to break this down clearly. Why is PCOS happening? And is it your fault? What is PCOS? And what it isn't? What are the symptoms and how do we diagnose it? And then we'll tie it all together by busting some common myths along the way. So let's begin with what women need to hear first. PCOS is not your fault. Some women are told that their condition is simply a result of poor lifestyle choices. If you've just lived a little healthier or didn't eat junk food, you'd be fine. Or they've been told it's because it's in their genes. Their fate is inevitable. This can be so misleading, and it doesn't reflect the full science. So rather than playing the blame game, let's consider why PCOS is really happening. It's a multifactorial condition, meaning there's more than just one reason why this happens. Let's dive into a few of them. The first is genetics. PCOS tends to run in families. If you have a female relative, whether that's a sister, an aunt, or a mother who also experiences the same symptoms, you may find that they also have it. Then there's genome-wide association studies that have actually identified genes that are linked to PCOS. These are related to hormonal signaling, reproductive regulation, and we also know now that the South Asian women are a particularly higher risk, and they often have more severe symptoms. But the most important thing to remember is that you are not doomed to PCOS. Your genes are more than your destiny, and we'll talk about this a little bit later. The second factor is insulin resistance. More than 80% of women with PCOS have insulin resistance. Here's the cracker. You do not have to be overweight to have insulin resistance. Insulin resistance basically means your body's cells don't respond to insulin. This causes a rise in insulin levels, which leads to a rise in blood sugar levels, and it can lead to disruptions in the balance between estrogen and progesterone, as well as male hormones. In PCOS, there's often fat stored around the organs, which worsens insulin resistance. The fat tissue itself becomes dysfunctional, triggering more inflammatory signals and a fewer impact on the helpful signals, which are anti-inflammatory. This impacts your metabolism and your hormonal balance. What is the end result? An increase in circulating male hormones, also what we call androgens like testosterone. And this is actually what leads to acne, excess facial hair, body hair, irregular cycles. And the third, and one of the most important points, is the influence that environment and lifestyle has. Research shows that many women with PCOS tend to eat more refined carbohydrates, sugary foods, and processed animal-based foods. This kind of diet increases something called advanced glycation end products, which can trigger oxidative stress and worsen insulin resistance. This doesn't mean we give up those foods, but it simply means we achieve more balance. We also know that there is more perceived barriers for women adopting movement or be consistent with movement. Does that mean we should be pushing harder? No. We simply need to start understanding. It's not as simple as diet more and move more, and we'll talk about this in the other segments of the series. And then we have the environmental toxins. Every day we're exposed to endocrine disrupting chemicals from plastics. A big culprit is something called BPA, and that's found in containers and packaging. These chemicals can mess with your hormones, especially when you're exposed at a young age. They can affect everything from reproductive function to insulin sensitivity, and they can even mimic or block your body's natural hormonal responses. And the link that ties all of this together is this concept called metaflammation. This is a low-grade chronic inflammation that is not only linked to PCOS, but it's also linked to other conditions like type 2 diabetes, heart disease, autoimmune disorders, and so much more. So, do we just accept this as a cause and move on? Most definitely not. Here's where things get really exciting. Thanks to a field called epigenetics, epigenetics basically teaches us that lifestyle environment can turn on or off your genes. That means that just because you've inherited a gene doesn't necessarily mean you'll develop a disease unless it's triggered. Factors like your mother's hormonal levels during pregnancy, your diet, sleep, stress levels, all can influence whether PCOS genes get switched on or off. So this gives us hope. It gives us hope that your daily choices can shape your future health, and we'll have another complete episode on this shortly. Now that you know that PCOS is not your fault, let's release that guilt, let's release the shame, and let's dive into what PCOS is as an actual condition. Let's take the word. Poly means many. Cystic refers to cysts or small fluid-filled sacs. Ovary refers to the female reproductive organ that produces eggs and hormones, and syndrome means it's a group of symptoms that often appear together. So basically, the name describes that the ovaries can look crowded with small, little, multiple follicles, kind of like a string of pearl appearance around the ovaries, and they're actually immature eggs that didn't get released properly. This then causes a dysregulation in hormones, the male and female hormone balance, as well as insulin. And this leads to irregular periods, acne, thick hairs down the midline, and so on. But here's the thing, not everyone with PCOS has these polycystic ovaries. So the name, a little outdated. The condition is much more about what's going on with the hormones. How do we diagnose PCOS? Clinically, PCOS is diagnosed based on something called the Rotterdam criteria. According to this, a diagnosis requires any of the two of the following three features. The first is irregular periods, less than 9 cycles a year or more than 35 days between your periods or no periods at all. The second is either clinical, meaning you have symptoms, or you have a biochemical in your blood test, signs of high male hormones or androgens. This can be things like acne, thick hairs down the midline, hair loss in a male pattern, and so on. And the third is polycystic morphology on the ultrasound of your ovaries. This is usually more than 12 follicles or an ovarian volume that is high of more than 10 ml. So as you can see, because you require 2 out of the 3 of the following criteria, you do not necessarily have to have ovarian cysts to be diagnosed with PCOS. Likewise, you could have normal regular periods and still have a diagnosis of PCOS if you fulfill the other 2 criteria. So this brings me on to the symptoms and the presentation and how they can be so different from one person to another. So let's talk about the common symptoms. This includes things like irregular periods, thick hairs, usually down the midline of the body, and this affects approximately 70% of women with PCOS. Then we have cystic acne. It's usually around the jawline and it's predominant around the chin. And we have insulin resistance or impaired glucose tolerance or type 2 diabetes. The loss of hair that we mentioned is especially in a male pattern kind of way, and then you usually have weight gain. And this is usually around the central area, and that's visceral fat accumulation. There's also things like fatigue, and this is probably one of the most overlooked symptoms, as well as mood disturbances, difficulties in conceiving because of irregular periods. Now, women with PCOS have 4 to 7 times higher risk of developing type 2 diabetes and metabolic syndrome. They're also at an increased risk of developing cardiovascular disease, endometrial thickening, and anxiety and depression. So as you can see, the symptoms are wide and vary. And what usually happens for women is they go to many different doctors for different presentations. A gynac for irregular periods, an endocrinologist for insulin resistance, a psychologist for mood disturbances, and a dermatologist for the skin issues. But this creates a fragmented care pathway where the root cause, the hormonal imbalance, insulin resistance, the inflammation, is not addressed holistically. So this is why it is called a syndrome. And this is why we need to start bringing all of this together under one big umbrella. This is why it's a mistake when anyone says PCOS is also called PCOD, which is polycystic ovarian disease. PCOD as a term is outdated and it's not recognized by any international medical society. Let's talk about it using its correct term, polycystic ovarian syndrome. You'll also realize that the way in which this syndrome presents is that you can have different manifestations of the syndrome during different parts of your life. And at each stage of your life, it may have different metabolic and systemic implications. So to summarize, PCOS is a common condition, but there are things that you can do within your lifestyle to reverse it. Diagnosis is based on clinical criteria, biochemical markers, and imaging. It is not based on guesswork, and it is a whole body condition that needs a whole person approach. We hope that helps you, and we hope you can share this with someone who needs it.